talking about our hamstrings. So a lot of people describe the feeling of tight hamstrings within their body. And the hamstring is the back of our thigh. And so if we look at a skeleton, you can see this is the front of the skeleton looking at our pelvis, and then coming into the side. Within looking at the skeleton in particular, you're going to see this area here, where in yoga, a lot of the times you'll hear people refer to this as your sits bones. So this bone is actually known as your ischial tuberosity, and it sits at the base of your pelvis. So put your hands on your hips. This is your iliac crest. These are your SI joints, your sacrum, your coccyx or your tailbone, and then here again is that sits bones. This is the insertion point for our hamstrings. So our hamstrings connect directly to the pelvis and then connect down into our knee, into our tibia, which is again, the long bone of the leg is our femur, and then we have our tibia and our fibula down into the lower shin area. When we have tight hamstrings, sometimes there is true tension in the hamstrings, and sometimes it's due to actual positioning of your pelvis. And so if we sit with somebody in a neutral pelvic position, the hamstring will be in an optimal position. The minute we start to have that anterior pelvic tilt, right, that booty pop position into the low back, what happens is this pelvis starts to rock forwards. And what that does is that lifts that ischial tuberosity positioning, that hamstring insertion position, and is chronically stretching that hamstring. So you may always feel like there's tension in the hamstring, but it could again be due to that pelvic unleveling. So neutral pelvis, less tension into the hamstring, anterior pelvic tilt, always stretching, always pulling on that hamstring, creating some sensation. So if you're somebody that feels that they have chronic hamstring tension or tightness, maybe take a look at your posture and just notice when you look at yourself in the mirror, are your hips level? That hip bone in the front is pretty close to that hip bone in the back, or do those bones tilt at an angle? So give that a try.